but I've been living with mental health conditions since 1993. And I wanted to be able to explain to you today a little bit about what it feels like to be part of the environment where a family, friend, caring team is trying to cope with somebody, and I was trying to cope with my own life, having been diagnosed with psychosis and schizophrenia after a period of manic depression. I've entitled my talk, You Can't Get Lost If You Don't Know Where You're Going. And the reason being, I thought it encaptured, although it's not a true quote apparently, it did encapture the idea that in the early 1990s, when I was diagnosed with mental health problems, the people around me, and myself included, really didn't understand what we should be doing and what it meant. I didn't know what it felt like before, and I was experiencing severe difficulties, and therefore we had a very difficult time of it. I then decided I was going to try and find some sort of more concrete evidences for you to try and illustrate what that was like. And I discovered in 2014 that the NICE Clinical Guidelines number 178 had pulled out some important parts of their understanding of the relationship between service users and their carers. And the first one, the most important one I think, is that the family and friends involved with somebody can either help or they can hinder that person's recovery. In my case, there was nothing but hindrance for a good few years, and that's really, I think, because nobody understood around me what it meant to have psychosis. They had no positive reference to go to try and find out what that meant. I myself didn't really understand what was happening, and thereby, and the next slide we'll talk about it, we suffered from what people describe as expressed emotions causing us difficulties as a unit of people. Later on, and it's the important final slide really, later on when we looked at why I had started to make a recovery, it was really all about the fact we got some insight. I got some insight into the illness, and my friends and family had some understanding of what it meant to have the illness. And thereby they could very strongly help the recovery that I was going through. Secondly, I think the failure of services to provide information at the time was a key factor, because it gave the impression to people around me that they didn't really have what it was that was necessary to help me recover. We didn't know what that was, but the lack of information coming from the services in the early 1990s meant that we felt that we were being talked at and talked to in the sense of what somebody should do, what they should be referred to, how they should live their life. It didn't really take much account of the realities of everyday life as we saw that. Also, that means that sometimes the individual, I know I felt it very difficult to trust the people that were involved in my care from the services, and the NICE Clinical Guidelines talks about, has a quote from a lady who had to fight and get very angry to be heard. My mum had to fight and get very angry to be heard. There were tears on numbers of occasions, and she felt as though we were being ignored and I was just being sort of put out to grass. If we were to write this up, it would be called Living Day to Day by Lodge, Lodge and Lodge. We haven't done, but the key thing really is it's about insight. You'll find when you're going through these experiences, you have no real understanding of what it is. And we need that understanding, we need a clear understanding, because it is a complicated problem. And the expressed emotion that happens when people are arguing, people are frightened, people are scared, I felt as though my life wasn't going anywhere, it creates a sort of havoc in the household, a really difficult situation. And that has that reciprocal negativity in the relationship, meaning people can't offer the positive things that you should be able to get from your trusting relatives and friends throughout the early stages and ongoing with psychosis. That's really the key thing to me. It's about insight, and therefore the recovery that you can start to build, it can be done as a community of people, a community of myself, my friends, my family. And what you can start to do is to take some positive ideas from information that you do get when you get it, and start to build yourself a plan and see if you take some small steps. These are all things that at the start were being said to us by services. However, we didn't have a way of doing it. It was very difficult to find the support services, the ideas, so the conversations weren't happening, and they were very frictious conversations indeed. And overall, with the information that you can get hold of nowadays, and React obviously is a great example of that, when people have the information, you can start to understand, and you can get that insight. And although you won't necessarily understand what it's like to be going through psychotic episodes, or to be feeling heightened paranoia, the fact is, if you understand what it is, and the person themselves can access some reference to other people who have been through that experience, you can start to get the basis of some early conversations that are not driven by the fear, driven by the ignorance, driven by the sense of isolation that the individual has, and driven by the sense of failure that often people can have, that makes them feel guilty about where they are and the fact that they're relying on the parents or the friends. All those emotions are happening, and it's very difficult to see a clear path forward. So what I'm hoping you'll see today from the React Toolkit and the conversations with people is when people do have a better understanding, you can naturally therefore start to make some more robust plans, some simple steps forward, and people can buy into the process. And as soon as people buy into the process, the individual themselves, as I found, I was willing then to engage with services rather than push them away, and then the recovery can start to develop along those lines.